Welcome to the Deep Dive. We're here to cut through the noise, take all that complex information, and really crystallize what matters.
That's the goal.
And today, we're diving into something. Well, it's a real puzzle in healthcare, isn't it? This paradox of why some people absolutely rush to the doctor for almost nothing.
A tiny sniffle, yeah.
Exactly. Well, others, people with genuinely alarming signs, they just wait, they delay getting help, sometimes dangerously so.
It's something we see constantly, and it's not just, people being difficult. It's about how our minds work under pressure, under the stress of feeling unwell.
Okay.
When symptoms hit, you're immediately in a triage situation. Do I need help? How urgent is it? And without a clear, objective way to assess, well, fear can take over. Or sometimes, oddly enough, overconfidence.
Leading to what you called misaligned action.
Precisely. Wasted trips to the ER for minor things, and tragic delays for serious conditions. It's a system failure, really, rooted in psychology.
So that really sets up our mission for this deep dive.
Yeah.
We need to get under the hood of Dr Maya AI, this color-coded symptom checker. Understand how it's designed to tackle this exact psychological breakdown. And there are two sides to this, right? First, how does it guide someone who maybe isn't a medical expert, someone who just needs clear, simple directions?
Right, the not-so-intelligent user, in the sense of not having specialized medical knowledge. Providing clarity there is key.
But maybe even more fascinating and definitely more critical in some ways is how it helps the other group, the knowledgeable people, the ones who think, I've read up on this, I understand biology, I can figure this out myself.
The intelligence trap.
Yes.
Yes.
How does Maya protect them from their own confidence, that tendency to self-diagnose and put off seeing a doctor until, complications are already setting in? That's a huge focus for us today.
It's absolutely crucial because that delay is often where the real danger lies. And the system's foundation comes from a key insight by Dr Kadiyali Srivatsa, Maya's founder.
He has a background in critical care, right? Decades of experience.
Over 40 years. And he noticed something striking. The vast majority of consultations, they all boil down to just 12 common symptoms. 12.
Only 12. That seems surprisingly few.
It is. But here's the catch. These 12 symptoms are double-edged swords. They could mean something trivial, a cold, indigestion, or they could be the very first whisper of something severe, something needing urgent attention.
So that's the immediate challenge. How do you sort that out quickly and safely?
Exactly. You need a tool that sees the pattern, not just the single symptom. And that's where traditional human triage often falls short.
Okay, so let's unpack this consultation paradox more. It's genuinely baffling. You see someone doubled over with abdominal pain, clearly needing help.
And they're saying, oh, it's probably just something I ate, I'll wait it out.
While someone else is in the waiting room because they sneezed twice and are convinced it's pneumonia.
It's the peak of misaligned action. And it really stems from how our brains process threat signals from the body. When you feel symptoms, your brain isn't this cool, logical calculator.
No. What is it then?
It's more like a receiver, a filter, and definitely a storyteller. We don't just react to the raw data of the symptom, we react to these conditioned thought loops.
The conditioned thought loops, like what?
Like past experiences, things you've seen in movies, deep-seated anxieties, you get a headache, and the immediate thought isn't, maybe I'm dehydrated, it's...
Brain tumor.
Exactly. The dramatic narrative, often driven by fear, hijacks the assessment.
So my internal storyteller is way more powerful than my internal doctor.
In that moment of stress, often yes. And add to that, when you're physically unwell, your thinking is literally compromised. You know that brain fog feeling?
Oh yeah, hard to focus, things feel fuzzy.
Right. So trying to accurately self-assess in that state, it's incredibly difficult. You might forget key symptoms when talking to a doctor later, or worse, anxiety makes you invent symptoms that aren't really there.
Or you misjudge severity, like a mild ache feels like agony.
Precisely. You might rate your pain a 9 out of 10 when, objectively, it's maybe a 3. This completely skews any self-triage attempt. Mistakes aren't just possible, they're almost inevitable if you're relying purely on how you feel in that foggy state.
Okay, so humans are, let's say, flawed triage machines when it comes to ourselves. Fear makes us rush, denial, or maybe that fog makes us delay. How have the tools we do have, like online symptom checkers, tried to fix this? And why haven't they really worked?
Well, they meant well, but their basic design is flawed because it doesn't match how medicine actually works. Most of them rely on these very rigid, linear binary decision trees.
Like a flowchart, yes, no question.
Exactly. Got a fever, yes. Got a cough, no. Click, click, click. And they tend to focus on one symptom at a time. Tell me about your headache, then separately. Tell me about your nausea.
Which isn't how a doctor thinks, right? They look at the combination.
Precisely. Experienced clinicians use pattern recognition. They see how symptoms cluster together. Headache plus stiff neck plus fever paints a very different picture than just headache alone. These checkers, with their single symptom focus, miss the picture.
It's like trying to identify a forest by looking at a single leaf.
That's a great analogy. You lose all context. And the results, well, the data is pretty concerning. Studies show diagnostic accuracy for many apps is shockingly low, sometimes as low as 19%.
19%. That's basically guessing.
It's not reliable. But the bigger danger, the really scary part, is the triage accuracy. Many of these apps have incredibly high rates of under-triage.
Meaning they tell someone it's not urgent when it actually is.
Yes, up to 67% in some studies. Imagine having appendicitis, using an app, and being told, hey, see your GP in a few days. That false reassurance leads directly to delayed care, complications, maybe even death.
So the fundamental problem is they're too simple. They can't handle the complexity, and they don't think like an expert.
They don't capture that crucial pattern synthesis. And that's the precise gap Dr. Maya aims to fill.
All right, let's shift to the solution then. If the old ways are flawed, what's the new approach? Tell us about Dr. Maya AI and how it moves towards this pattern-based idea.
Dr. Maya AI comes directly from Dr. Srivatsa's decades in critical care. His vision isn't just about tech, it's almost philosophical. It's about empowering individuals against things like misdiagnosis, unnecessary treatments, and the huge threat of antibiotic resistance.
And this builds on his earlier work, right?
Yeah.
Something called PD.
Yes, the pediatric assessment tool. That was about bringing structured, objective observation to assessing sick children, taking subjectivity out of high-stakes decisions. Dr. Maya essentially takes that core principle, the need for structured, objective data, and uses AI to apply it to complex symptom patterns in adults, too.
So it's taking that structured approach and scaling it with AI.
Exactly. Building a reliable framework from what can feel like chaotic human experience.
Now, it's really important we clarify this. Dr. Maya is not a diagnostic tool, right? It doesn't tell you you have the flu or you have appendicitis.
Absolutely critical distinction. It's a personal healthcare assistant. Its main job is triage, helping you understand the urgency and the appropriate next step based on the pattern of your symptoms.
And the core innovation here is that shift from single symptoms to pattern recognition, using what you call the symptom triad.
Yes. Instead of yes-no questions about isolated symptoms, Maya looks at the combination of 3 symptoms you provide. This directly mimics how expert doctors think. They synthesize symptoms A, B, and C together to figure out what's likely going on.
Why 3 symptoms specifically? Why is the triad the magic number?
It seems to be the sweet spot. Dr. Srivatsa's work started with those 12 common symptoms. The AI was trained to find the most predictive clusters among them. Going from 1 symptom to 2 gives a big jump in accuracy. Going from 2 to 3, the triad often hits the optimal balance, meaning it significantly improves the ability to predict risk, sensitivity, and specificity without making it overly complicated for the user. Adding a 4th or 5th symptom often gives diminishing returns on accuracy, but makes the app harder to use. 3 is usually enough to see a meaningful pattern.
And this idea of triads isn't new in medicine, is it? There are classic examples.
Oh, absolutely. Medicine has relied on triads for ages. Think about the classic malaria triad: fever, plus intense chills or rigors, plus an enlarged spleen. In areas where malaria is common, that pattern has about an 81% accuracy.
Right.
Or the typhoid triad: fever, abdominal pain, and headache. That cluster points towards typhoid with 85–90% accuracy.
Wow.
And maybe the most famous one, the diabetes mellitus triad with the 3 Ps: polyuria, peeing a lot; polydipsia, drinking a lot; and polyphagia, eating a lot. That pattern is about 90% accurate for new-onset diabetes. Dr. Maya basically teaches your eye to see these combinations.
So the user puts in their 3 main symptoms. The AI analyzes that pattern based on its training and assigns a color code. Let's break down those colors. What do they mean, and what do they tell the user to do?
It's designed to be crystal clear, remove the guesswork. 4 main colors.
Okay.
Green means self-care. This is for really minor stuff: an isolated mild cough, slight sniffles. The key here is isolated and mild. If you only have 1 or 2 green symptoms, the message is, relax. You likely don't need a doctor or pharmacist right now.
Got it. What's next?
Yellow. This is category 4, or semi-urgent. The action is specific. Speak to a pharmacist or perhaps call your GP's nurse advice line. These are symptoms that need professional advice but aren't necessarily an emergency. Mild but persistent symptoms, maybe.
Okay, makes sense. Then it ramps up.
Exactly.
Yeah.
URI-AD is category 3, urgent. This means you need prompt medical attention. The instruction is clear. Call NHS 1101 or your local equivalent urgent medical helpline, or get to an urgent care center immediately.
What triggers a READ?
It could be an isolated but severe symptom, like sudden blinding headache or fainting even once. Or, crucially, it could be a specific combination of less severe symptoms that, together, form a high-risk pattern pointing towards serious infection or organ issues.
So the pattern itself can trigger ORD, even if no single symptom seems that bad on its own.
That's the power of the triad analysis.
And the last color, blue.
BLUE is unique. It's for isolation. If your symptom pattern suggests a potentially infectious illness, like the flu, it advises voluntary self-isolation. This isn't just for you. It's a public health measure to help prevent community spread. Think surveillance, outbreak prevention.
That's clever. Using it for community health, too.
Yeah.
But what about safety? Someone anxious could just keep putting symptoms in, hoping for a green, right? The hypochondria issue.
Addressed head-on. First, the app has clear boundaries. It's designed for generally healthy adults and registered children experiencing new acute symptoms. It is absolutely not for people with chronic conditions like diabetes, complex histories, or those on multiple medications. They need their regular doctor.
All right. Always consult your doctor if you have ongoing conditions.
Always. And for the obsessive checking, the app has a built-in limit. It freezes if you try to use it more than 3 times in a single 24-hour period.
3 times and you're locked out for the day.
Yep. It forces a pause. It stops that anxious cycle of re-entering slightly different symptoms, hoping for a different answer. It encourages reflection rather than reaction.
But hang on. What if someone's symptoms genuinely get much worse after those 3 tries? Isn't locking them out a bit risky? How do you balance stopping the anxiety loop with actual safety if things change rapidly?
That's a critical point. The system works on a baseline assumption. If your symptoms rapidly worsen to a point where you're seriously concerned, think RED-level symptoms appearing suddenly, the primary advice always defaults to seeking immediate human medical help. Call emergency services if needed.
Regardless of the app.
Regardless of the app status. The 3-use limit is there to break the cycle of someone repeatedly entering green or yellow symptoms, tweaking them slightly, hoping for a different, maybe more reassuring outcome. If you genuinely need assessment beyond 3 tries within 24 hours, especially if things are worsening, you likely need human interaction anyway, like that NHS 111 nurse triage, not more self-assessment via an app. It gently pushes you towards that human oversight when necessary.
Okay, that makes sense. It's a nudge towards human help if uncertainty persists or things escalate.
Exactly. It's about interrupting unhelpful loops, not blocking necessary care.
We've covered why someone without medical training needs this kind of clear, color-coded guidance. It cuts through the fear and the fog. But now, let's tackle that core paradox Dr. Srivatsa highlighted, the intelligence trap. Why does the person who is knowledgeable, who feels confident in their understanding, also need to use a tool like Dr. Maya?
This is where things get really interesting, and frankly, quite dangerous. The highly intelligent person, or someone with, say, a science background, often makes a critical error. They equate possessing knowledge with having sound clinical judgment under duress.
Meaning they think because they know things, they can accurately diagnose themselves.
Precisely. They use their understanding of biology or medicine to build a seemingly logical rationale for delaying help. They convince themselves they can handle the truth of their symptoms. It's a subtle form of intellectual arrogance.
How does that play out?
Well, they might subconsciously position themselves as being brave or rational for enduring a symptom. Oh, I know the statistics. This severe headache is almost certainly just a tension headache. I don't need to panic. They rationalize away the low probability, high impact possibility.
So knowledge becomes a shield against taking action rather than a tool for informed action.
Exactly. It reinforces confirmation bias. I know the symptom could be serious, but it's probably not. Therefore, I'll treat it as not serious. There's an interesting analogy, you mentioned it earlier, about using brutal honesty as a weapon.
Right, where someone hurts another person with harsh truths and then blames the victim for being upset.
Yeah. In self-diagnosis, the intelligent person uses their knowledge to rationalize delay. I understand my body. This chest tightness is just indigestion. I'm not going to overreact. Then, if it turns out to be an early heart attack warning sign and things escalate,
They feel foolish or embarrassed.
exactly. They feel bad for bleeding, metaphorically speaking, because their own intellectual defense system failed them. They couldn't handle the truth their body was telling them because their brain rationalized it away.
Can you give a concrete example? Maybe someone with medical training.
Sure. Think of a nurse or even a doctor experiencing vague upper abdominal discomfort and maybe some nausea. They know the list of possible causes is enormous, from gas to gastritis to gallstones to something cardiac. Because simple gastritis is incredibly common, they might latch onto that diagnosis. It feels like gastritis. I had a stressful week. It fits. They might ignore the slight shortness of breath that accompanies it, or the fact the pain feels a bit different this time.
Because they're focusing on the common explanation their knowledge provides.
Yes, but that pattern, vague upper abdominal pain, nausea, maybe slight breathlessness, could be an atypical presentation of a heart attack, especially in women, or early appendicitis, or pancreatitis. By focusing on their knowledge of commonality, they override the pattern that an objective tool like Maya, which is programmed to consider rarer but dangerous combinations, might flag as RD. They delay until the pain is unbearable or they collapse.
Their intelligence becomes a vulnerability.
It traps them. They trust their interpretation over the objective pattern.
And the consequences of this delay, driven by misplaced confidence,
They're huge.
right, both personally and for the healthcare system.
Immense. Personally, delaying treatment for serious conditions means worse outcomes, longer recovery, potential disability, even death. Systemically, it's incredibly costly. Early detection and treatment are almost always cheaper and more effective.
How much more costly is delayed care?
The data suggests hospital costs increase by nearly 2% on average just due to delay. But for really severe cases that present late, the resource need can be 5 times higher. Think ICU beds, complex surgeries, prolonged rehab, all because that initial window for simpler intervention was missed, often due to this kind of intellectual rationalization.
So Dr. Maya forces even the knowledgeable person to step back from their subjective interpretation and follow a structured, objective protocol.
It levels the playing field. Your intelligence doesn't get to override the pattern recognition when the stakes are high.
Now, Dr. Srivatsa's work recognizes that people think and process information differently. It's not just about smart or not so smart. The AI is designed to help various kinds of genius. Let's explore a few of those. How might different intelligence types still fall into traps that Maya helps avoid?
Right, we're talking about different cognitive strengths here. Maya's structured approach helps counter the specific biases each type might have.
Okay, let's start with someone highly attuned to sounds and rhythms, musical intelligence.
Someone with strong musical intelligence might be incredibly sensitive to subtle changes in their body's rhythms, a slight heart flutter, a change in breathing cadence, maybe even joint crepitus. They hear the change.
Which sounds like an advantage.
It is in detection, but the risk is they might leap from noticing that subtle change directly to a specific, narrow diagnosis. That flutter means arrhythmia X without considering the full pattern. They might ignore the accompanying fatigue or dizziness because they're so focused on the rhythm change. Maya forces them to input all 3 main symptoms, providing the complete context.
Okay. What about the bodily kinesthetic type, the person who learns through doing, through physical sensation?
These individuals are often very aware of physical feelings, pain location, muscle tension, how their body moves. They can describe the physicality of a symptom very well.
Again, sounds useful.
It is, but their focus can be too localized. They might be fixated on the specific muscle that aches, meticulously describing that sensation, while downplaying or ignoring the mild fever and general malaise that accompany it. They miss the systemic picture because they're zoomed in on the physical part. Maya makes them list the other symptoms, forcing that broader view.
Interesting. Then there's the interpersonal type, the social connector.
Yes, someone strong in interpersonal intelligence, understands group dynamics, reads others well, often seeks consensus. When they feel unwell, their default might be to consult everyone.
Ask friends, family, the pharmacist down the road.
Exactly. They gather opinions. My sister had something like this. The chemist said, it's probably just X. This creates a cloud of conflicting, subjective advice from people who don't have the full picture or clinical training. Maya replaces that unreliable crowdsourcing with a single, objective, evidence-based recommendation.
It cuts through the social noise.
Precisely. And finally, perhaps the group most susceptible to the intelligence trap.
The intrapersonal type.
Yeah.
The self-aware ones.
Yes. These are the introspective explorers. They have a deep understanding of their own emotions, motivations, internal states. They genuinely believe that because they know themselves so well, they can accurately interpret what's going on inside their body.
I know my body. I know this feeling. It's nothing serious.
That's the mantra. Their profound self-awareness paradoxically leads them to trust their subjective interpretation above all else. They are the most likely to delay seeking external validation because they feel their internal insight is sufficient. Maya acts as that crucial objective check, forcing them to confront the pattern data, even if it contradicts their internal feeling or self-assessment.
So for all these types, Maya provides an essential external anchor, a structured way to assess symptoms that counteracts their specific cognitive biases or tendencies towards misinterpretation or delay.
That's the key idea. It standardizes the approach, regardless of your particular intellectual style or confidence level.
Okay, we've seen how Maya works on the individual level, tackling those cognitive traps. But its design clearly aims higher at fixing some fundamental problems within healthcare systems themselves, especially where resources are tight.
Absolutely. It's designed to counteract what Dr. Srivatsa calls artificial demand. That's the demand for healthcare services driven less by genuine patient need and more by, frankly, the financial incentives built into the system.
How so?
Well, think about the cost of healthcare infrastructure, particularly in places like India. A modern hospital bed can cost upwards of 2 crores, which is roughly $240,000 US. When you have that kind of massive capital investment,
You need to ensure it's being used, generating revenue.
exactly. It creates pressure, sometimes subtly, sometimes overtly, for doctors to maximize throughput, maybe order more tests, admit more patients. They can even be tracked on revenue targets, turning caregivers partly into, well, salesmen.
Which isn't ideal for patient-centered care.
Not at all. Dr. Maya, by providing accurate triage before someone even gets to the clinic or hospital, helps filter out the noise. The green cases that need self-care, the yellow cases that just need a pharmacist. This frees up doctors and nurses to focus their limited time and resources on the red and maybe yellow cases that genuinely require their expertise.
And in places with significant doctor shortages, like India.
It's even more critical. You mentioned the stats. 1 doctor per 11,000 people reported in 2020, huge shortfalls of nurses in rural areas. Maya provides sophisticated, reliable guidance where that human expertise simply isn't available 24/7.
That efficiency saving, that reduction in unnecessary consultations must have a knock-on effect on another huge global threat, antimicrobial resistance.
What's AMR?
A massive one. AMR, the rise of superbugs, is arguably one of the biggest existential threats we face. And it's driven primarily by 2 things: poor infection control and the massive overuse and misuse of antibiotics.
How does unnecessary antibiotic use actually create resistance? Can you walk us through that? Sure. It's about selection pressure. When you take an antibiotic, it kills off susceptible bacteria, hopefully the ones causing your infection, but it also wipes out loads of the beneficial bacteria in your gut and elsewhere, the ones that normally keep things in balance.
Okay.
Now, within any large bacterial population, there might be a tiny number of bacteria that just by chance have a gene that makes them resistant to that antibiotic, with all their competitors wiped out by the drug.
They have the whole place to themselves.
Exactly. They can multiply rapidly, take over, and even share their resistance genes with other bacteria around them. So every time antibiotics are used unnecessarily, say, for a viral infection like a cold where they have 0 effect, you're essentially running a training camp for superbugs in your own body.
And this misuse is widespread.
Rampant. Look at the early COVID-19 data. One study found over half of hospitalized COVID patients were given antibiotics for a virus. This constant unnecessary pressure is what's driving resistance globally.
So how does Maya interrupt this cycle?
By improving triage accuracy. If Maya helps you correctly identify your symptoms as a green, likely viral self-care, or maybe a yellow pharmacist advice, you avoid that unnecessary trip to a doctor or clinic where perhaps out of an abundance of caution or diagnostic uncertainty, you might have been prescribed antibiotics just in case.
It reduces those wasted consultations that often lead to unnecessary prescriptions.
Precisely. Fewer unnecessary visits mean fewer unnecessary antibiotics, slowing down the relentless march of AMR.
Let's talk numbers on safety and efficiency. How much better is this color-coded system at getting people to the right level of care compared to older methods?
The data is striking. Dr. Maya's approach has been shown to reduce inappropriate referrals, people being sent to a higher level of care than needed by about 55% compared to traditional symptom checkers.
55%, that's huge.
It's massive. Think about the resources saved ER slots, doctor time, but also think about patient safety. Every unnecessary trip to a hospital or busy clinic is a potential exposure to nasty hospital-acquired infections like MRSA.
Which can spread easily in those environments.
Very easily, through contact, contaminated surfaces, even things like call buttons. Reducing unnecessary foot traffic in hospitals is a significant win for infection control and public health.
Finally, any tool aiming for universal access, especially using AI, has to confront the issue of fairness and bias. How does Dr. Maya ensure it works reliably for everyone, across different backgrounds and literacy levels?
That's a cornerstone of ethical AI development. The system must be fairness aware. That means it has to be trained on data sets that are inclusive and diverse, representing different ages, genders, ethnicities, and health statuses, geriatric patients, children, pregnant women, immunocompromised individuals.
So the patterns it recognizes aren't just based on one specific group.
Correct. That mitigates the risk of algorithmic bias, ensuring the guidance is equitable. And beyond the data, there's the user interface. Dr. Maya includes a specific mode called Ashapath.
Ashapath, what's that?
It's designed specifically for users who may be illiterate or have low literacy. Instead of reading text prompts.
It uses pictures.
Exactly. Icon-based selection combined with voice instructions. So the system might ask via audio, do you have pain? And the user selects an icon representing pain, maybe a grimacing face, or an icon for fever, like a thermometer or a sweating forehead.
That makes this sophisticated triage accessible regardless of reading ability.
That's the goal. Universal access to informed decision-making. The whole philosophy rests on this. When you feel symptoms, ask Maya first. Get that objective pattern assessment. It helps you avoid dangerous delays when a seemingly trivial symptom combination is actually serious, and it cuts down wasted consultations, protecting both you and the healthcare system. #outro.
This has been a truly comprehensive deep dive. We've journeyed through the psychology behind why we sometimes rush for help and why we sometimes dangerously delay it, exploring fear, cognitive fog, and that tricky intelligence trap. And we've seen how Dr. Maya AI aims to bypass these human failings, not by replacing judgment, but by enhancing it through objective pattern recognition, the symptom triad, and that clear, actionable, color-coded triage.
And I think the ultimate synthesis here, the really powerful takeaway, is that Dr. Maya isn't just about clever algorithms. It's fundamentally a movement towards restoring patient autonomy.
How so?
By giving individuals clear, reliable, evidence-based information at the moment they need to make a decision, it allows them to participate as equals in their own healthcare. It embodies that ideal. Knowledge of health is knowledge of life.
It equips you to make the call.
It equips you. And that brings us to a final thought, really, about agency in health. If we believe health is fundamental to human dignity, and if even deep philosophical traditions suggest that our free will, our ability to deliberate and choose, is paramount.
Then AI shouldn't take that away.
Exactly. The most ethical application of AI in this space isn't to be a black box that spits out a diagnosis for you. It's to be a transparent tool that empowers you with the best possible knowledge to make your own informed choice, ensuring you're an active participant, not just a passive recipient, in managing your health and potentially preventing the next crisis, big or small.